Thank you, Your Excellency. Your Excellency, Joao Lorenzo, President of Angola and Chair of the African Union, it's beyond words. Thank you so much for blessing us with your presence. I'm very grateful, Your Excellency President. Obrigado. And Your Excellency, Andrei Plenković, Your Excellency, Liu Guzhong, Excellencies, Honorable Ministers, and Heads of Delegation, dear colleagues and friends. My thanks to Farah El-Dibani, Elian Vidal, and Eunice Miller for sharing your voices, your gifts with us this morning. My thanks also to all youth delegates who have joined us today. And my thanks to Member States for your historic adoption today of the WHO pandemic agreement. One of the first major speeches I gave after my election as Director General at this Assembly 8 years ago was at an event at Columbia University in New York. The subject I was asked to address was whether 100 years since the 1918 influenza pandemic, the world was ready for the next one. That pandemic erupted during the First World War, and although it killed more people than the war itself, it was quickly forgotten and its lessons went unheeded. I said then that a devastating epidemic could start in any country at any time and kill millions of people because we're not prepared. I said that global health security is only as strong as its weakest link, and that no one is safe until everyone is safe. And I said that we do not know where or when the next global pandemic will occur, but we do know that it will exact a terrible toll, both on human life and on the global economy. The following year, 2018, at the World Government Summit in Dubai, I said the same thing again. And I said it again in 2019 in an interview with Time magazine, a rare interview that I did. Later that year, on the 31st of December 2019, I was at home with my family when I received a notification on my phone. As the rest of the world was celebrating the dawning of a new year, WHO staff in Beijing and Geneva had picked up the first signal of cases of viral pneumonia in Wuhan. The next day, the 1st of January 2020, when most of the world was on holiday, WHO was not. Immediately, we activated our emergency incident management system and alerted the world, and within the first 10 days, we convened global experts and published comprehensive guidance for countries on how to protect their populations and health systems. I'm proud of WHO's response to the pandemic, and of course, we're not perfect, no one is, but from the moment we received that first signal, and for the next 3 years, we did what WHO was created to do. We acted fast, and we told the world that what we knew when we knew it. We brought countries, experts, and partners together to review rapidly evolving evidence and distill it into guidance on which governments, health workers, and our partners relied. We worked to give member states the evidence, the advice, and the tools to protect their people. And we did it all based on evidence, data, and our values of equity and solidarity. The COVID-19 pandemic turned our world upside down. It stole at least 20 million of our sisters and brothers. And many of us in this room lost someone we know or love. It took a terrible toll on health workers who worked under extreme conditions, often without the equipment they needed. It wiped more than 10 trillion US dollars from the global economy. It damaged or destroyed the livelihoods of countless people. It pushed millions into poverty. It interrupted the education of millions of students. It took a heavy toll on the mental health of countless others who suffered from fear of the disease or the loneliness of isolation. It gave rise to torrent misinformation and disinformation that undermine trust in science and institutions, a trust deficit that remains to this day. And it exacerbated political tensions within and between nations. Just over 2 years ago, I declared an end to COVID-19 as a public health emergency of international concern. The crisis has passed, but the scars remain. Millions of people continue to suffer from the lingering effects of long COVID, and the social, economic, and political aftershocks continue. The pandemic has ended, but we still don't know how it started. Understanding how it did remains important, both as a scientific imperative and as a moral imperative for the sake of those who lost their lives. We must not forget the painful lessons that COVID-19 taught us. We must learn from them, and together that's what we have done in 10 ways. First, financing. COVID-19 showed us that financing for pandemic prevention, preparedness and response in lower-income countries was woefully inadequate. So with the World Bank, WHO established a pandemic fund in 2022 to support capacity building in lower-income countries. Already, the pandemic fund has provided $885 million in grants, catalyzing an additional $6 billion in co-financing, supporting 47 projects across 75 countries. Second lesson is intelligence. The pandemic showed us the need for much stronger intelligence to detect signals of outbreaks earlier and enable a more rapid response. That's why in 2021 we established the WHO Hub for Epidemic and Pandemic Intelligence in Berlin. And we expanded the epidemic intelligence from open sources platform, which monitors millions of signals every year and has tripled in scale to include 103 countries. Third, local production. The COVID-19 pandemic taught us that manufacturing capacity for vaccines and other medical countermeasures was concentrated in too few countries, and that we need much greater geographical diversification of production. So in 2021, we launched the mRNA Technology Transfer Program based in South Africa, which is now sharing technology with a network of 15 partner countries globally. And we also established the Biomanufacturing Workforce Training Initiative, including Global Training Hub in the Republic of Korea, which has helped to train over 7,000 participants in biomanufacturing. Fourth, access. The COVID-19 pandemic exposed vast inequities in access to vaccines and showed the need for a mechanism to coordinate equitable sharing of vaccines, therapeutics, diagnostics, and other tools. So in 2020, with a consortium of partners, we established the Access to COVID-19 Tools Accelerator and COVAX, which distributed almost 2 billion free doses of vaccine to 146 countries. In lower-income countries, COVAX represented 75% of vaccine supply, saving an estimated 2.7 million lives. Building on the lessons learned from ACT-A and COVAX, we established the Interim Medical Countermeasures Network in 2023, which has helped to coordinate access to vaccines against Mpox. And fifth, supply chains. The pandemic highlighted gaps and inefficiencies in supply chains for life-saving medical products in emergency situations. So together with our partners, we expanded and optimized our supply chains to ensure urgently needed supplies get to where they're needed on time, every time. 6, sample sharing. This is pathogen sample sharing. The pandemic highlighted the need for a mechanism that enables countries to share samples and sequences of pathogens to facilitate research and development. So with the support of the Swiss Confederation, we established the BioHub, which is facilitating the sharing of pathogens with epidemic and pandemic potential. And the Research and Development Blueprint for Epidemics and Pandemics is managing collaborative open research consortia for 12 families of pathogens involving over 5,000 scientists to drive R&D and identify gaps in countermeasures. 7th, rapid deployment. The pandemic highlighted the need for an international system to coordinate the rapid deployment of experts to respond to emergencies nationally, regionally, and globally. So in 2023, we established the Global Health Emergency Corps, which just last month ran a two-day simulation called Exercise Polaris with 350 experts from 15 countries. 8, the IHR COVID-19 exposed limitations in the international health regulations. So you negotiated and adapted a package of amendments to strengthen them. And 9, UHPR. It highlighted the need for increased accountability, so we created the Universal Health and Preparedness Review, a peer review mechanism. And 10th, and the last one, the pandemic showed us that pathogens don't carry passports, viruses don't need visas, and bugs don't respect borders. For everything that makes us different, we're one species, sharing the same planet, the same DNA, and the same vulnerabilities. A shared threat demands a shared response. And so in 2021, you, the member states, made the historic decision to negotiate a new legally binding agreement on pandemic prevention, preparedness, and response. Last night, you approved it. 124 member states voted in favor and none against. We recognize that 11 countries abstained, and we hope that all member states will continue to work together to address the concerns that some of you have. And this morning, you adopted it. There are many people who have helped to bring us to this point, too many to name. But I would especially like to thank 3 people who first proposed and drove the idea. His Excellency Kais Saied, the President of Tunisia, who proposed the idea in a phone call in April 2020. And the late President of Chile, His Excellency Sebastián Piñera. And His Excellency Charles Michel, former President of the European Council. I also thank the co-chairs of the Intergovernmental Negotiating Body who have guided us throughout this process. Ambassador Anne-Claire Amprou of France, Precious Matsoso of South Africa, and former co-chair Roland Dries of the Netherlands. I also thank our vice-chairs, Ambassador Tovar of Brazil, Ambassador Ramadan of Egypt, Dr. Viroj of Thailand, Ms. Flair Davis of Australia, and our former vice-chairs, Ambassador Ahmed Salama of Egypt, Ambassador Honsi Kozo of Japan, and Mr. Kazuho Taguchi, also of Japan. And I thank my colleagues in the WHO Secretariat who have worked tirelessly to support this process over the past few years. My Deputy Director General, Dr. Mike Ryan, Dr. Jawan Bahjur, and the many colleagues who supported them. Over the past 3.5 years, you have engaged in very tough negotiations. Sometimes the disagreements were sharp, the discussions heated, and the frustration evident. Sometimes it seemed the distance between you might be too great to overcome. There were those who said you would not succeed, could not succeed, and who did not want you to succeed. But you kept your eyes on the prize and did not stop until you had achieved it. You didn't want to give up on this very important prize. Step by step, you moved from red lines to green text, from entrenched positions to landing zones, and from contradiction to compromise, convergence, and consensus. You began your work in the middle of one crisis, and you have reached this milestone in the middle of another. And today, we celebrate. Today, you have sent a loud message that multilateralism not only works, but is the only way to find shared solutions to shared threats. Let's not understate what you have achieved. You have made the world a safer place. I repeat, a safer place. And our youth delegation agree with that, and they have said it in their statement. By establishing a new system for sharing pathogens, vaccines, and other tools, by facilitating the transfer of technology, knowledge, skills, and expertise, by setting up a coordinating financial mechanism, by establishing a global supply chain and logistics network, by mobilizing a skilled, trained, and multidisciplinary national and global health emergency workforce, and much more. This is what the pandemic agreement will do. But there is one thing it will not do. It will not infringe on national sovereignty in any way, nor give the WHO Secretariat power to impose mask or vaccine mandate or lockdowns. Anyone who says it will is clearly mistaken. You, the member states, have made that very clear in the text of the agreement itself. You're all aware of the torrent of mis- and disinformation that we have faced through the negotiation of this agreement. And although you have now adapted it, deception and distortion will continue. So we must be very clear about this. The pandemic agreement has been negotiated by countries, for countries, and will be implemented in countries in accordance with their own national laws. Nobody knows this more than you. It doesn't belong to me or to my colleagues in the WHO Secretariat. It belongs to you, the nations of the world, and through you, to your people. And of course, although today we celebrate reaching a major milestone, it's not the end of our journey. We have not yet reached our final destination. In the coming weeks, and months, you will begin the process of negotiating the annex on the pathogen access and benefit sharing mechanism, PABS. After that, the process of ratification will begin before the agreement finally enters into force. There will still be hurdles to overcome. But having seen the commitment that got you this far, I have every confidence that you will go the rest of the way. Let me return to the question I was asked to address in that speech at Columbia University. Is the world prepared for the next pandemic? By the way, people ask me this question now many times. Many people who meet me say, are we prepared? My answer, we can never be prepared enough. There is always more we can do. But are we better prepared now than we were when COVID-19 struck 5 years ago? My answer, absolutely. With this agreement, we're better prepared for a pandemic than any generation in history. And that's true. And all the 10 things which I have outlined earlier. While negotiating the pandemic agreement, we have been building the 9 things which I have outlined. Because we learned, the word learned from the challenges of COVID. Failure will always be there. But the key is, have we learned our lessons? I think we did, and that's why we're doing the 10 things. The most important being the 10th one, which is the pandemic agreement. Excellencies, Mr. President, Joao Lorenzo, honorable ministers, dear colleagues and friends. Since 1948, the nations of the world have gathered at the World Health Assembly to discuss common health threats and to find a common path forward. There have been many historic moments. In 1969, the Assembly adopted the International Health Regulations. In 1974, it approved the expanded program on immunization that has saved millions of kids. In 1980, it declared the eradication of smallpox. In 1988, it adopted a resolution to eradicate polio. In 2003, it adopted the Framework Convention on Tobacco Control, which is saving lives as well. And in 2021, at only the second special session of the Health Assembly, you decided to negotiate a new international agreement on pandemic prevention, preparedness, and response. Your adoption this morning of the WHO pandemic agreement will rank among the most significant achievements in the history of this organization and of global health. Those of us who were lucky enough to be in the room at 1:57 a.m. on the 16th of April, or in committee last night, or here this morning, will remember it for the rest of our lives. We will all be proud to say, I was there. But the point is not the words of the agreement on which you have spent so many hours discussing, debating, and deciding. The point is the people of our world. This is about making the world safer for them and their children and grandchildren, for us, for our children and our grandchildren. Together. Thank you for your determination to get this done. Many were skeptical, but you got it done. And this is through determination and commitment. And I have seen it spending the whole night in a windowless auditorium in a basement. I was so moved when I saw you negotiating the whole night, from 9 to 9, non-stop. That moved me, and I could see the determination and commitment. That's why it happened. Thank you for showing that in our troubled world, nations can still find a way to work together. And thank you for the gift you have given the world today. A special gift on May 20th, 2025. That's your gift to the people of the world, the best gift. Thank you so much. I thank you.
Congratulations. Thank you, Director General Dr. Tedros. I would like to invite the high-level guests to join me and the DG in front of the podium for a group photo with the delegates. I invite all delegates to stand for this photo.
Where's it? I'll suspend it. I read it.
The plenary is suspended. Correction. Let us now suspend this item, and we will return to the statements from our high-level speakers. Please take your seats. I now have the pleasure to invite the President of the United Republic of Tanzania, Her Excellency Ms. Samia Hassan, for her remarks.
Your Excellency, Chair of the World Health Assembly, WHO Director General, distinguished delegates, ladies and gentlemen, it is an honor to address this historic assembly to renew our shared commitment to health as a human right and key foundation to sustainable development. With the enduring support from WHO, United Republic of Tanzania continues to make great strides in the health sector, particularly in public health and pharmaceutical governance. In 2018, Tanzania Medicines and Medical Devices Authority became the first national regulatory authority in Africa to be recognized by WHO to have achieved maturity level 3. This is a right path on achieving pharmaceutical sovereignty in Africa and strengthening our collective initiative to ensure access to safe, effective, quality-assured medicine and health technologies towards universal health coverage. Additionally, our primary healthcare services expanded from 6,790 facilities in 2014 to 11,275 in 2025, translating to 78% of the population accessing health care within 5 kilometers. Furthermore, health centers providing emergency surgery, including cesarean sections, have increased from 107 in 2015 to 577 in 2024. All these efforts led to reduction of maternal mortality rate from 556 deaths per 100,000 live births in 2015 to 104 deaths in 2022. Other strides made are in the reduction of harmful practices such as female genital mutilation from 10% in 2015 to 8% in 2022, reducing complications of pregnancy and childbirth. Certainly, Tanzania could not have realized all this without WHO's steadfast partnership at all levels. We remain grateful for walking this journey with us. Excellencies, despite these gains, challenges still remain. Our health systems are under strain from health rates and rising cost of health care, to mention but a few. In addressing some of these challenges, we are undertaking a comprehensive reform in public health financing, including the introduction of the universal health coverage, so as to pool resources for equitable access to quality health care, infrastructure, and human capital development. Primary health care and service integration remains our priority for a holistic approach. Excellencies, in conclusion, I urge all of us to reaffirm our commitment to WHO as the cornerstone of health collaboration. United we stand, divided we fall, and in this regard, we must garner all our efforts to build a world with better health security. We must ensure no one is left behind. Wishing you a successful assembly, and I thank you so much.
Thank you, Excellency. I have the honor to invite the President of Cabo Verde, His Excellency Mr. José Neves, for his remarks.
Cabo Verde ascendeu à independência em 1975. Há 50 anos, a situação sanitária era quase de calamidade generalizada e desnutrição grave. O arquipélago tinha...
Our archipelago had a life expectancy of 56 years and an infant mortality rate of 108 per 1,000 live deaths. The situation was extremely difficult and the provision of drinking water was insufficient. Sanitation was also insufficient, and there was a lack of coverage in terms of infrastructure and health care. This was fertile ground for the appearance of various diseases such as tuberculosis, whooping cough, diarrhea, and others, including measles. In the face of this situation, the authorities set up priorities such as health, health infrastructure, and the fight against poverty. Cabo Verde was part of the WHO in the year after it was created, with the first agreement in order to create fruitful production through strong presence of our country at the WHO. This significantly contributed to us setting out patterns of excellence and quality healthcare. This alliance that we created translated into significant support in which strategies were defined, as well as frameworks and sectoral and multi-sectoral policies. More specifically, we developed the national health system and created universal health coverage, as well as providing protection for health emergencies. I'd also like to highlight the valuable support for the fight against epidemics and for setting up vaccine campaigns. We received the certification as a malaria-free country. We are very grateful as a country for the excellent cooperation that we've had over these years. By way of thanks, the President of our Republic gave the WHO the Emil Cabral Prize last year, showing that the WHO had led the fight in difficult situations that faced humanity in terms of health over the last few years, particularly the COVID-19 pandemic, for example. So, we would like to give warm thanks to the whole of the WHO and all of those who have dedicated themselves to commemorating the anniversary. We would like to use all means at our disposal so that WHO can continue with its noble mission of saving lives. Thank you.
Thank you, Excellency. I have the honor to invite the Prime Minister of India, His Excellency Mr. Narendra Modi, for his remarks.
Excellencies and delegates, Namaste. Warm greetings to everyone at the 78th session of the World Health Assembly. Friends, the theme of the World Health Assembly this year is One World for Health. It resonates with India's vision for global health. When I address this gathering in 2023, I had spoken about One Earth, One Health. The future of a healthy world depends on inclusion, integrated vision, and collaboration. Friends, inclusion is at the core of India's health reforms. We run Ayushman Bharat, the world's largest health insurance scheme. It covers 580 million people and provides free treatment. This program was recently extended to cover all Indians above the age of 70 years. We have a network of thousands of health and wellness centers. They screen and detect diseases such as cancer, diabetes, and hypertension. Thousands of public pharmacies provide high quality medicines at far less than the market price. Friends, technology is an important catalyst to improve health outcomes. We have a digital platform to track vaccination of pregnant women and children. Billions of people have a unique digital health identity. It is helping us integrate benefits, insurance, records, and information. With telemedicine, nobody is too far from a doctor. Our free telemedicine service has enabled over 340 million consultations. Friends, due to our initiatives, there has been a heartening development. The out-of-pocket expenditure as percentage of total health expenditure has fallen significantly. At the same time, government health expenditure has gone up considerably. Friends, the health of the world depends on how well we care for the most vulnerable. The global south is particularly impacted by health challenges. India's approach offers replicable, scalable, and sustainable models. We would be happy to share our learnings and best practices with the world, especially the global south. Friends, in June, the 11th International Day of Yoga is coming up. This year, the theme is Yoga for One Earth, One Health. Being from the nation which gave yoga to the world, I invite all countries to participate. Friends, I congratulate the WHO and all member states on the successful negotiations of the INB Treaty. It is a shared commitment to fight future pandemics with greater cooperation. While building a healthy planet, let us ensure that no one is left behind. Let me close with a timeless prayer from the Vedas. Sarve bhavantu sukhinah, sarve santu niramaya, sarve bhadrani pashyantu, ma kaschid dukh bhag bhaved. Thousands of years ago, our sages prayed that everyone should be healthy, happy, and free from disease. May this vision unite the world. Thank you.
Thank you, Excellency. I have the honor to invite the Prime Minister of Norway, His Excellency, Mr. Jonas Gahr Store, for his remarks.
Excellencies, ladies and gentlemen, and dear friends, in times of political and financial uncertainty, this 78th World Health Assembly is an opportunity to demonstrate the continuing importance of this extraordinary fine organization, the World Health Organization. Norway was a founding member of WHO and has been and continues to be a staunch supporter of the organization and its critically important mandate. I have personally a strong commitment to this organization, having had the privilege of serving as Chief of Staff to former DG, Director General, Dr. Gro Harlem Brundtland, some 25 years ago. And as I see it, it's pretty easy to state the following. WHO is more important than ever in our globalized world. WHO has repeatedly demonstrated its importance as a global, convening and coordinating body. It is the leading normative and technical organization on health matters. It stands in the Constitution, and it has always been demonstrated at the critical junctures of our times. WHO plays an important role both in health emergencies and in humanitarian response. This period of uncertainty is pushing us to reconsider the global health architecture. Regardless of how this develops, WHO will have to maintain a central role, and all governments should be held accountable to delivering on that. So from Norway's point of view, it's our ambition that WHO comes out of this crisis stronger and more resilient, sustainably financed, and more efficient, transparent, and accountable. I know this is complicated with leading nations pulling out, but we have to continue our work. And I would like to applaud the efforts of WHO Secretariat, with the strong leadership of DG, Dr. Tedros, to deliver a realistic budget and a bold revised structure. Hasn't been easy, but you have been working well on it. We, the member states, need to do our part. It's our responsibility to assure sustainable financing, including by increasing assessed contributions, because this is crucial in order to safeguard the core mandate of the organization and to assure a WHO fit for the future. Supporting WHO is a collective responsibility and for the mutual benefit of all its member states. Progress in the negotiations for a pandemic agreement demonstrates that we can work together and make meaningful steps towards better health preparedness for all. Let that be a beacon of light guiding us in the time to come. So to all of you working for World Health, in small local communities, in large hospitals, in research, and across the whole web of health in the world, this year's World Health Assembly is there to thank you, to underline the importance of the work you are doing, and to show politically that we take responsibility for the futures. There are some countries, again, pulling out, not taking that shared responsibility. That cannot make the rest of us stop and look in another direction. We have to move on, and thank you for being committed, and thank you for doing that critically important work for humanity.
Thank you, Excellency. I have the honor to invite the Prime Minister of Singapore, His Excellency, Mr. Wong Lawrence, for his remarks.
Excellencies, distinguished delegates, ladies and gentlemen. We are meeting at a time of great uncertainty. The international system is under severe strain. The COVID-19 pandemic is behind us, but the risk to global health persists, and the need for coordinated action has never been greater. The World Health Organization, or WHO, has shown us that international cooperation remains possible in these uncertain times. Countries successfully concluded negotiations on the pandemic agreement last month. This historic agreement aims to improve how the world prepares for and responds to future pandemics. Despite deep differences, countries managed to reach consensus after 3 years of tough negotiations through sustained diplomacy. This is an encouraging development, both for global health and for multilateralism. It reminds us of what we can achieve as an international community when countries come together to find common ground and forge shared solutions. Singapore is firmly committed to an open, stable, and rules-based multilateral system. We believe that global problems require global solutions. That is why we have been steadfast in supporting the WHO and its role in global health governance. Singapore was amongst the first to pledge to the WHO investment round last year. This reflects our commitment to global health security. Recently, we hosted the Philanthropy Asia Summit, which provided a platform for philanthropic foundations to support meaningful causes, including more resilient healthcare systems. Singapore will continue to do our part for global health, because as the theme of this World Health Assembly reminds us, we all live on one world for health. A disease anywhere can become a threat everywhere. Viruses know no borders. The only way forward is for all of us to tackle global health challenges together. So let us join hands to build a healthier, safer, and more resilient world for all.
Thank you, Excellency. I have the honor to invite the Prime Minister of Lao People's Democratic Republic, His Excellency, Mr. Soneksai Sifadoni, for his remarks.
สบายดีขอแสดงความนับถือมายังบรรดาท่านรัฐมนตรีผู้อำนวยการใหญ่องค์การอนามัยโลกในบรรดาแขกผู้มีเกียรติทุกท่านข้าพเจ้ารู้สึกเป็นเกียรติที่ได้มีโอกาสมีความเห็นในกองประชุมสมัชชาใหญ่ขององค์การอนามัยโลกครั้งที่78ในมื้อนี้การระบาดของพยาธิโควิด -19 ที่ผ่านมาถือเป็นระยะเวลาที่ยุ่งยากสมควรแต่ในขณะเดียวกันเหตุการณ์ดังกล่าวได้เฮ็ดให้พวกเราเห็นถึงความ
While a dark time, the COVID-19 pandemic, as has often been said, without health we have nothing. Our country joined the World Health Organization in 1950. WHO became the first United Nations agency to establish an in-country office, taking place in 1962. Since then, we have worked hand in hand in improving maternal and child health, immunization, communicable disease control, quality of care, capacity building for our health workforce. Health promotion and more, with many significant achievements towards health for all, including in the early 1980s, oral polio vaccines were introduced. And in 2000, the disease was eliminated. We have eliminated trachoma in 2017 and lymphatic filariasis in 2023. Similarly, the threat of malaria has almost been eliminated, with less than 350 cases in 2024. Between 2000 and 2023, the ratio of mothers lost during pregnancy or childbirth has fallen by over 80%, one of the fastest declines globally. Throughout these milestones, WHO has been a constant and committed partner. We could not have achieved these results without WHO. Lao PDR has a great deal of effort ahead and many more milestones to achieve, particularly implementing the Health Sector Development Plan to achieve universal health coverage, and support the country's LDC graduation. An appropriately and sustainably resourced WHO is essential to achieve our shared goals. Not just for countries like Lao PDR, but for the world. While tools like the Pandemic Accord are a demonstration of WHO's unique value to help us get there. Excellencies, Lao PDR is a proud member of WHO. And on behalf of the government of Lao PDR, health officials, healthcare workers and communities, I thank WHO and development partners for their immense support in the health sector of Lao PDR.
Thank you, Excellency. I have the honor to invite the Prime Minister of Vietnam, His Excellency Phan Minh Chinh, for his remarks.
Thưa Ngài Tổng Giám đốc, thưa các quý vị đại biểu,
Tôi rất là cảm ơn ngài Tổng thống.
At the outset, I would like to thank you for this opportunity to address the 78th World Health Assembly.
Thứ 78 này, tôi muốn chia sẻ.
I would like to share with you my thoughts as follows. First, we have always placed the people at the heart of national construction and development. Deeming them as the best resource and driver for growth. Therefore, Vietnam has long given priority to endeavours concerning human development, under the principle that the people constitute the most important asset for society, and health is the most important asset of the people. Investment in the people and their well-being means investment in development. And we spare no effort in making such investment, striving to the best of our capability and available resources for healthcare and human development. Second, in today's world, issues concerning healthcare or the people are global, whole of population and comprehensive in nature. Therefore, we need to uphold multilateralism, strengthen international cooperation and unity, and offer mutual support to address these challenges. COVID-19 was exemplary for this. Other instances include climate change, aging demography, and depletion of resources. Such obstacles require the international community to join hands to overcome. This has been very much proven, and I am certain that you are all well aware of this. Third, I believe that wealthy developed countries should assist poorer developing or less developed nations. In terms of science, technology, capital and manufacturing capacity. Most notably, focus should be given to the production of medicines and vaccines to best prevent pandemics and cure diseases, consultation in establishing necessary institutions, and support in human resource development and healthcare capacity building. We hope that such assistance will continue to be provided in a more robust, altruistic, and effective manner going forward. On Vietnam's part, we are committed to implementing the regulations of the World Health Assembly, particularly the decisions made at this 78th Assembly. Although Vietnam also faces its share of hardships, we should always be ready to contribute to these common efforts and offer our experience, knowledge, consultation and achievements to the international community. We will also continue to adhere to the warnings of the WHO and the World Health Assembly. Despite existing hurdles, Vietnam remains determined to invest further in human development and healthcare, in tandem with other countries worldwide. Only then can we build a world wherein the well-being for all can be guaranteed. And foster greater strength in promoting human development and protecting the lawful and legitimate rights and interests of the people to health, life, freedom and happiness. Once again, I would like to extend my heartfelt thanks to the World Health Assembly. May the 78th World Health Assembly be a great success.
Thank you, Excellency. I now have the honor to invite Senator the Honorable Penny Wong, Minister for Foreign Affairs, on behalf of the Prime Minister of Australia.
Excellencies, Director General Dr. Tedros, distinguished colleagues, I am honoured to join you from Australia to celebrate this historic achievement. In 2020, COVID-19 caused widespread devastation with loss of lives and livelihoods across the globe. The pandemic reshaped our lives, our countries, our economies, and our world. But while we were all impacted, it was the poorest and most disadvantaged who were hit the hardest and who paid the highest price. COVID-19 crystallised in the starkest of terms what we already know to be true. Global challenges require collective action. That's why the world came together with a shared ambition to act on hard-earned lessons, to work towards an agreement to reduce the risk of future pandemics and make the world safer for everyone, no matter who you are or where you live. Because we know these health emergencies don't recognise national borders. But if we work together, we can save lives, preserve livelihoods and boost resilience. Today we take a significant step forward in that endeavour. We recognise the importance of collaborating across sectors at national, regional and international levels, including working in an integrated way to address risks to human health, animal health and environmental health. And we agree to take concrete action collectively to strengthen pandemic prevention, preparedness and response. Adopting this agreement not only affirms our shared commitment to action, guided by principles of equity, it also demonstrates the value of the international community working together to find solutions to shared global challenges. Australia is proud to have served as the Vice Chair of the Intergovernmental Negotiating Body for the Pandemic Agreement, representing our diverse Western Pacific region, and I commend all negotiators for their hard work. I also thank Director General Tedros, World Health Organization staff and UN and civil society colleagues and other stakeholders for your support and contribution to this agreement. Let's continue to move forward together to make our world safer and healthier for all.
I now have the pleasure to invite Mr. Oliver Barhelio, Commissioner on Health, on behalf of the President of the European Commission, to give his remarks.
More than 5 years ago, in the midst of the COVID-19 pandemic, a cross-regional group of leaders called on the international community to do something new, to come together to step up our international cooperation and solidarity so that we can all be better prepared for future pandemics. Now, the international community has crafted provisions that promise to change how we prevent, prepare for, and respond to future pandemics for the better. Global cooperation is essential if we want to tackle our shared problems. Pandemics know no borders. Fighting them means working together. Combating serious cross-border threats to health is essential, both at regional and international level. It protects the lives of our citizens and the prosperity and stability of our societies. The pandemic agreement has a broad scope. It ranges from upstream prevention, surveillance of environmental drivers and animal health, all the way to managing the supply chain of pandemic-related health products. If we achieve all this and strengthen domestic healthcare systems, we will have a more robust international framework for preparedness and response, in full respect to the health policy competencies and responsibilities of individual EU member states. I'm sure that the cooperative spirit of the negotiating parties will continue and grow as we negotiate the remaining part of the agreement. The European Union will remain at the forefront of efforts to support international cooperation on global health.
Thank you. At this point, I am informed that the Director General would like to recognize the contribution of two outstanding individuals for their exceptional endeavor and commitment to advancing global health. Dr. Tedros, you have the floor.
I'm honored to present the Director General's Award for Global Health to Professor Awa Mary Kolsek and Professor Sir Brian Greenwood. Their invaluable contributions have helped to alleviate the burden of malaria and other vaccine-preventable diseases and to build sustainable health system capacity in Africa. While serving as Senegal's Minister of Health, Professor Awa Mary Kolsek led landmark reforms, expanded universal access to care, and integrated disease control program. In addition to making significant contributions to scientific literature, Professor Kolsek was the Executive Director of the Rollback Malaria Partnership, leading efforts to accelerate malaria interventions in low-income countries. Professor Kolsek has played numerous other critical roles in the global health architecture, including in technical advisory roles with WHO. So such a great honor to invite Awa, my sister, to the podium to receive the award. Welcome. Yeah. Senegal, yeah, Senegal. Senegal is in the house. Yeah? Thank you. You know, we work. Thank you. So, yeah, thank you. Congratulations.
Dr. Tedros, to give his remarks.
Thank you, Your Excellency. Your Excellency, Joao Lorenzo, President of Angola and Chair of the African Union. It's beyond words. Thank you so much for blessing us with your presence. I'm very grateful, Your Excellency President. Obrigado. And Your Excellency, Andrei Plenković, Your Excellency, Liu Guzhong, Excellencies, Honorable Ministers, and Heads of Delegation, dear colleagues and friends. My thanks to Farah El-Dibani, Elian Vidal, and Eunice Miller for sharing your voices, your gifts with us this morning. My thanks also to all youth delegates who have joined us today. And my thanks to Member States for your historic adoption today of the WHO Pandemic Agreement. One of the first major speeches I gave after my election as Director General at this Assembly 8 years ago was at an event at Columbia University in New York. The subject I was asked to address was whether 100 years since the 1918 influenza pandemic, the world was ready for the next one. That pandemic erupted during the First World War, and although it killed more people than the war itself, it was quickly forgotten and its lessons went unheeded. I said then that a devastating epidemic could start in any country at any time and kill millions of people because we're not prepared. I said that global health security is only as strong as its weakest link, and that no one is safe until everyone is safe. And I said that we do not know where or when the next global pandemic will occur, but we do know that it will exact a terrible toll, both on human life and on the global economy. The following year, 2018, At the World Government Summit in Dubai, I said the same thing again. And I said it again in 2019 in an interview with Time magazine, a rare interview that I did. Later that year, on the 31st of December 2019, I was at home with my family when I received a notification on my phone. As the rest of the world was celebrating the dawning of a new year, WHO staff in Beijing and Geneva had picked up the first signal of cases of viral pneumonia in Wuhan. The next day, the 1st of January 2020, when most of the world was on holiday, WHO was not. Immediately, we activated our emergency incident management system and alerted the world, and within the first 10 days, we convened global experts and published comprehensive guidance for countries on how to protect their populations and health systems. I'm proud of WHO's response to the pandemic, and of course, we're not perfect, no one is, but from the moment we received that first signal, and for the next 3 years, we did what WHO was created to do. We acted fast, and we told the world that what we knew when we knew it.